Hello, my name is Gallagher. I am a plastic and reconstructive surgeon specializing in gender affirmation surgery based in Indianapolis, Indiana. So first things first, I gotta point out my new shirt, which you guys have probably noticed. So this is a gift from one of our patients, just a clinic the other day from Kazan. Thank you so much, Kazan. I am loving my new shirt. So as you can see, my shirt is green because I'm Irish and I have this little four-leaf clover as well. But let me tell you a little bit about this company, Bluefish, that Kazan told me about. So Bluefish is a gender-neutral clothing company based out of Louisville, Kentucky, and they're pretty awesome for that. But not only that, they actually donate every month 10% of sales, not proceeds, sales to different charities. So they also have wonderful shirts. I'm loving mine and wearing it right now. And thank you again so much, Kazan. That's very kind. So let's move on with the meat of this video. While wearing this shirt, I'm going to do a transmasculine topic, and what I'm going to talk to you guys a little bit about is hysterectomy. So first of all, I am a plastic surgeon. Us plastic surgeons don't do hysterectomies. You need a GYN surgeon in order to get that done. Now, first of all, what do we know about hysterectomies for transmasculine patients? First thing to know is not every transmasculine patient will want or need a hysterectomy. And again, like so many things in gender affirmation surgery, it really comes down to a personal choice on what that patient needs in order to be affirmed. So there's one nice study done on this, and when they surveyed a lot of trans men, what they found was out of that survey, about 25% of trans men had already had a hysterectomy. About somewhere around 50% wanted to have a hysterectomy in the future, and just over 20% of trans men had no interest in undergoing a hysterectomy in the future. So, a couple of things to know. And I would say more importantly from my point of view is it is possible to combine both procedures, as in you can combine top surgery and do a hysterectomy at the same time. Or if you're ever considering bottom surgery, this can also certainly be combined at the same time. So a couple of things to know, because this comes up a lot with us. I'll be seeing a patient for top surgery and then they'll be, oh yeah, actually I am interested in having a hysterectomy, and how can we do that? So a few caveats about that. First of all, it's a longer anesthetic, obviously. So my procedure usually takes about 2 hours depending on how large the patient is, and then you add in the GYN's portion, which probably give or take about another 2 hours. Oftentimes we will keep a patient overnight because of this, but I think we've sent 1 or 2 patients home the same day, so it's definitely possible. It does certainly add a little bit to the recovery, because now not only does your chest hurt and you're kind of like a T-Rex and not moving your arms from what I've done to you, but also your belly hurts too after the surgery. There's a few different ways of doing hysterectomies, and really I encourage you to discuss this with your GYN surgeon. Not all ways are suited to all patients, and a particular GYN may specialize more, for example, in doing a robotic surgery or a laparoscopic surgery. So really I leave that up. That's a discussion between the patient and their surgeon. Another thing to remember is if you do want to combine the two, and in order to get it through insurance, and not that we want to be gatekeepers, we got to think about what that insurance policy will want your GYN to have in place in order to get the surgery approved. So if we look at the WPATH standards, which is a little bit controversial, 2 mental health letters are required and recommended by WPATH, so we may see that showing up in insurance policies as well. So not only, for example, for a patient who wants to undergo top surgery, they will now need a second letter. Typically we don't need 2 letters for a patient to undergo top surgery. surgery, but that's just another thing. And then of course, just logistics. When you're trying to combine two surgeons working together, that can be difficult. We have to make sure we both have privileges in the same place, and now you're working around two surgeon schedules, which can be a little bit more tricky, but we certainly do it, and it certainly can be done. What I would advise is, very early in the process, it's useful, if you think you want to combine the two procedures, to give your surgeon a heads up, so that we know well in advance how to meet your needs. So that's basically it with regards hysterectomy. I hope this is useful. Go to our website for more information, as usual, at www.universitygenderaffirmationsurgery.com. We also have Instagram, Dr. Gallagher. Check me out there, Facebook, and have a great day.